Hi there, my name is Rae O'Leary. I am a respiratory therapist and nurse, and I work at Missouri Breaks Research, which is located here in Eagle Butte. I also have a master's degree in public health, and I have led the Canli, which is the Lakota word for tobacco, the Canli Coalition of CRST for about the last 12 years. We work in a variety of sectors within tobacco that include tobacco cessation, tobacco prevention among youth, as well as tobacco policy work. What you should be watching for is a packet that looks like this that will be distributed through IHS. If you're in need of one and you can't get one, I'll put my contact information in the email, so please reach out. So I'm just going to go through some of the components of that and give you kind of an update on what you need to know related to tobacco as a healthcare provider on Cheyenne River. So we're going to start here by some current data about our own population on Cheyenne River. I will say this data is a little bit dated because we haven't had the opportunity to repeat the American Indian Adult Tobacco Survey yet, but that is in the works. So hopefully within the next year, we'll have updated data. Most of this is from 2012, I'll say. So you can see here that in 2012, 51% of our adult tribal members were current smokers. That's very high. It actually is higher than the US smoking rate in 1964, before the Surgeon General first announced that smoking is harmful. You can also see that about 1 in 10 of our adult members here use smokeless or chewing tobacco, and that's the same for both men and women. When we look at vaping, of course, that's more common in younger populations, including, all the way down to middle school. The youth tobacco survey that's done with the state found that in 1 in 20 middle schoolers who are white have vaped before. And in the American Indian population within South Dakota, it's 1 in 5. So there's definitely a disparity there. It's definitely something that should be addressed with all young people who you see in the clinic. I guess the rate of incline among high schooler e-cigarette users decreased following the EVALI outbreak, I guess. But most recently here, just between July and March of 2021, there's been a big uptick in e-cigarette sales in the United States. So we expect that those numbers are going to rebound, unfortunately. Also, it's super important as a clinician on the Cheyenne River Reservation that you're aware of traditional tobacco. The Lakota word for that is chanshasha. And chanshasha is the Lakota people's sacred plant that's used for prayer or ceremony. It might be smoked, but it does not contain nicotine or any additives, and it's not intended to be inhaled. From 2012 data, we learned that 30% of adults on Cheyenne River who are tribal members use tobacco for prayer or ceremony. And of that 30%, 70% of them use chanshasha, so the traditional tobacco, but another 30% use commercial tobacco for their traditional purposes. And this is oftentimes due to convenience and availability. So it's important to know the difference when you're asking about tobacco use, and to also distinguish between traditional and commercial tobacco when you ask that question. When we look at secondhand smoke here, 1 in 4 adults report that smoking is allowed in their home, and 1 in 3 report that smoking is allowed in their vehicle. So I think compared to national rates, this is high. Here at Missouri Breaks, we've done some intervention research with a smoke-free homes project, and it was very successful. We were able to work with about 162 households on Cheyenne River, and we're able to see a big change in their exposure at home. And then if we look at here, cessation, this is again from 2012, but of those who saw a healthcare provider within the last year, 90% were asked if they smoke, but only 48% were advised to quit. And you can see when we ask from smokers their interest in quitting, that about 7 out of 10 of them would like to quit smoking. So we know that there's a lot of interest there. In contrast, only 33% of the smokers actually tried to quit within the past year. So there's a big difference between those that are interested in doing it and those who actually make an attempt. You can also see that 78% of people who made an attempt did it cold turkey, and less than 1% of quit attempts involved nicotine replacement or medication. And this is self-report from the patient. Potentially maybe they're prescribed meds, but not taking them. Something to consider if you feel like this number is too low. So kind of back to the advice to quit. Known tobacco use that is not addressed by clinicians is generally perceived by patients as acceptable. Asking about tobacco use and exposure at every visit is very important. I have included some of the ICD-10 codes, both for nicotine dependence and exposure to environmental tobacco smoke. Both of these are really important to document in the chart. So it can kind of be flagged as a potential problem if there's recurring visits for, say, earaches in the ER. So then again, not only asking, but advising the tobacco users to quit at every visit, not just once, but if they hear it over and over and over again from multiple providers, the hope is that eventually they'll be ready to take that step and make an attempt at quitting. I've included some CPT codes, both for the intensive and brief interventions for smoking cessation. Of course, motivational interviewing is super helpful. There's some great videos on YouTube if you want to check those out on your own time for some tips. And then, of course, discouraging the use of e-cigarettes. There's no clinical trials at this point that prove that e-cigarettes are safe or effective for cessation. And then the final step is refer. The South Dakota QuitLine actually only asks that patients be willing to consider quitting within the next 30 days. It's really important to think about your word choices when you're asking patients if they are interested in quitting smoking or vaping or chewing, whatever their substance is. Because if you just say, are you ready to quit smoking today? That's a very different question, meaning, I'm going to leave this building and never smoke again, versus are you willing to consider quitting within the next 30 days? And if they're just willing to consider it in the near future, the South Dakota QuitLine will take it from there and kind of move them through the stages of change and get them ready to take that step within the month. There is a South Dakota QuitLine referral form in both the Cheyenne River IHS and Tribal Health EHR referral tab. And it's really important to use that because that will generate kind of a something that can be traced. Basically, the important thing is to use it, know that it's there, and then not just complete it in the chart, but also take the time to print it and fax it to the number that's at the bottom of the screen. Just doing this in the chart there's no setup that makes this automatically generate to the South Dakota QuitLine. You actually have to print it and fax it in. And to get to that form in EHR, you would click on New Consult, click on South Dakota QuitLine. I believe it's the last one in the list. Fill out the form and then print and fax. If wanting to quit in more than 30 days, maybe they're not ready this month, but maybe down the road, enter the patient goal and give education printouts to prompt future dialogue. Also, I just wanted to kind of give a shout out to the South Dakota QuitLine and the number here. There's QuitLine programs in every state of the nation, and South Dakota actually ranks number 1 for quit success 7 months after completing phone coaching. So of those who actually complete the phone coaching, 7 months later, 41% of them have stayed quit. And that's considerably higher than most states. If the patient doesn't have a reliable phone, we found that can be a barrier. Inviting them to use the clinic for their scheduled follow-up calls is a solution to explore. And the South Dakota QuitLine also for postpartum or pregnant women, they do 4 extra calls because they've identified that that's a key area that needs to be intervened on, and that sometimes those women need a little bit more support to stay quit after they have baby. There is an online training that is pretty in-depth. It's very well put together. It's called Prof, and I've included the link here. I'll also include that in the email if you'd like to check that out. It takes about an hour to an hour and a half, but there's some great resources in there if you're interested in learning more about tobacco cessation. So this is the form that we just reviewed. If you want to refer back to anything there. There's also a couple data briefs from the South Dakota QuitLine, one for American Indians and one for youth and young adults. on the back here, interestingly, it shows that 83% of individuals enrolled by phone, 6% were referred by a healthcare provider, and 10% enrolled on the website. So definitely room for improvement, but something that, sometimes even just that nudge of, have you heard of the South Dakota QuitLine, might encourage them to call in or visit the website so they can enroll on their own. Also, the state has a Kickstart program now where the individual can get 2 weeks worth of nicotine replacement in the mail, and just kind of do it on their own without the phone coaching. A screenshot of the EHR referral form for your reference, and then a couple booklets. This one here has just a variety of resources. The Canli Coalition that I work with partnered with Great Plains Tribal Leaders Health Board to put this together. And there's all kinds of great resources either for clinicians or patients that are interested in quitting. One big thing that you'll see in here is that Cheyenne River actually has one of the most comprehensive and well-enforced indoor smoke-free air policies in the nation. The other thing is, if you're interested in the difference between traditional and commercial tobacco, or maybe just to learn more about the relationship between the two and some stories and learn more about the culture, this book will also be in the packet. It's a wonderful resource that it gives a comprehensive overview of chinchasha, or the traditional tobacco, if you're interested in learning more. And then, of course, a stethoscope clip for the South Dakota QuitLine, and these little quit cards that have the South Dakota QuitLine number, the Canli Coalition's information, including our Facebook page. If you're interested, follow us. We have ongoing resources. And then on the inside, it has details about the ordinance or the smoke-free air policy for Cheyenne River and enforcement. So with that, I'd like to say thank you for your time if you hung in there till the end. If there's anything that Missouri Breaks or the Canli Coalition can do to support either you as an individual provider for Cheyenne River or your facility as a whole, please reach out. With that, I thank you, and I hope to hear from some of you.